Welcome to the Lifestyle First podcast, discussing lifestyle medicine and making self-care as easy as 1, 2, 3. 1 question, 2 research reviews, and 3 actionable health tips, all centered around the Lifestyle First method, your blueprint for the 10 key routes of optimal health and happiness. And now your host, lifestyle medicine physician and coach, Dr. Alka Patel.
Hello and welcome to Season 5, Episode 7. Today we are continuing to take a deep dive with my co-authors into the book, A Prescription for Healthy Living. And the theme in the Lifestyle First method we're exploring today is why, your connections. And the question we're discussing is, why is having a mentor or coach an important tool for my well-being? 2 references to support today's discussion are the chapter on mentoring in the book, A Prescription for Healthy Living, and also a 2015 paper in the Australian Journal of Primary Health, looking at empowering parents through a family mentoring program. So today I have with me Dr. Maha, who is a GP from Bristol, and she's also an academy lead at the University of Bristol. She's a member of the British Society of Lifestyle Medicine, and she says that she can truly see the benefits that healthy living brings her patients. She enjoys running, she enjoys yoga, and right now she is enjoying the joys of being a new mum. So Nita, welcome. Lovely to have you on the show.
Nice to meet you. Thank you.
Amazing. So I thought we could maybe just kick straight off and talk about what a mentor is. Have you got a definition? It's a word that gets used quite a lot, but what is a mentor?
Yeah, so I think everyone has heard of the word mentor, but it is a word that people have different meanings for. One of the definitions that I personally like is that a mentor is an experienced and trusted advisor. And one of the key words here is trust. I think trust has an important word and concept. I mean, right from school to senior jobs, we form relationships which can have a significant impact on our well-being. And sometimes we find that one person who we click with, who we look up to, and that can actually form the start of a mentor-mentee relationship. The actual word mentor is really historic. It actually features in Greek literature. That's my bit of history that I learned, and it was part of Homer's poem, The Odyssey, and it describes the fact that one of the king of Ithaca left his country, and when he was leaving, he wanted to leave his son in the care of someone who would act as a teacher, advisor, and friend. And it turned out the person's name was Mentor. So that perhaps is a bit of history that I looked up. But you can kind of see how mentor have been present for several generations and are a really important thing.
I love that little story actually, because it raises the words caring and trusting as well, which is sort of so important in any sort of mentoring relationship, isn't there? But exactly. Does it imply a sort of sense of hierarchy, do you think? Is it always someone who is more experienced than you, has got sort of much more wisdom than you that they're imparting to you? Or is there something about a level playing field with mentorship?
So I think it's not always hierarchical. I think there is a kind of tradition to think that a mentor is a more senior or older person, but actually there are cases when a mentor can be a younger person. For example, with the digital revolution, there was a time when certain companies paired up their older colleagues with their younger members of staff who perhaps were more experienced in a certain type of technology. So I think it's often the case that the mentor is a more experienced person, but it's not always an older person.
Yeah, I think it's really useful to make that clarification, isn't it? Actually, right, in the digital world, we're often looking towards our younger peers. I certainly am looking towards my children, not that I would call them my mentors necessarily, exactly a source of experience and wisdom in certain areas for sure. But why would you look for a mentor? What are the actual sort of benefits, would you say, of having a mentor as a key person in your life?
So I mean, there are loads of benefits, hence the reason why I'm here talking to you. I mean, I think one of the key things that people like is having a positive role model, and actually someone that you can look up to. I think we can all remember that person when we were at medical school, and perhaps we were sat in a clinic and we saw one of our senior colleagues and thought, I want to be like you when I grow up and be a real doctor. And perhaps that person stayed in touch with you and guided your career, and that could progress to an informal mentor-mentee relationship. So I think definitely a role for having a positive role model. I think a second benefit would be someone that could help with stress levels. I mean, certainly doctors are under incredible pressure, especially in this COVID era, and having someone that you can turn to for a source of support and reliability in a changing world, or perhaps a changing hospital, changing systems, someone who knows you personally, can be really beneficial. I know that there are cases of junior doctors and they often feel a bit lost in the system, but having that one person to go to, I think, can be really, really helpful. And following on from that, I mean, there's, as we probably all know, that the UX-Dodson law looks at an individual's performance under stress, and how up to a certain point stress can improve performance. But there is unfortunately a point which you can reach where too much stress can cause a decline, and that is, that can lead to burnout, and that's something that needs to be identified. And having that one person who knows you can perhaps help with that. They can perhaps see whether you need motivating, or perhaps whether you need to rein it in a little bit, or whether you're on the point of burnout. I mean, I think another key thing is that mentors are not just important in work. We have them for every aspect of our life. And one of the studies that I looked at by Ayton and Joss was a qualitative study. And it looked at this program called Creating Opportunities and Casting Hope program, which was a family mentoring scheme for vulnerable parents. And what it did was match vulnerable parents with a mentor who could help them on parenting skills, financial issues, domestic issues. And it really did find that having an opportunity to discuss their parenting strategies and financial issues provided a lot of guidance to them.
That's really interesting, actually, because I guess what's going through my head at the moment is mentoring, coaching. So what you've just described, is that mentorship or coaching? Again, another word that we talk about, you use quite a lot. Would you say there's a difference between mentoring and coaching, and what are those sort of blended areas which cover both? I'd be quite interested in your views around that.
Sure. So I think mentoring and coaching, they are often used interchangeably, and there is overlap. And again, like I've said, these are often ill-defined terms and people have different meanings. But I would say that most people would view having a mentor as more of perhaps a longer term approach, based on mutual respect and trust. Whereas often a coach is brought in for a specific reason, perhaps to help improve performance, like sports coaches are. And often they follow a more structured approach, perhaps addressing a particular issue. So there is definitely a difference, but I think both can be valuable. It may be that they're the same person. Your coach could be your mentor, but perhaps you have a mentor who's been a steady source of support, and then you still require a coach to help with a particular issue.
Yeah, no, I get that. I mean, I think for me, my differentiation tends to be around a mentor is very much sort of in an advisory capacity. So has often got lots of advice and things that they can sort of tell you to do and signpost you to and support you with. Whereas coaching is very much about the coachee having the tools and the resources already available to them, and having that conversation and an opportunity for a conversation which sort of guides them to really tune into probably what they already know, but just need this little bit of support with that final decision making and moving forward and edging forward. So I think you're right. I think there are important distinctions, but also there's space for both in our lives for sure. I very much think that everybody should have a coach, just like everybody's got a doctor, everybody's got a coach, because I think as medics we tend to do the sort of a bit of the mentorship, we tell people what to do with the expectation that they'll leave our consultation rooms and go off and do all of that. But actually, this is where the coach really comes to life. It does take you from what I talk about in this podcast all the time, which is take you from knowing to doing, giving you that activation to really do these things. And I think it should be something that we're all really proud of, as having that coach or mentor even in our lives, for sure. I don't know what your views are on that.
I mean, I totally agree with you. I think having a coach and just someone that can provide focus to us. Sometimes we don't always see our weaknesses ourselves, and it's useful to have that person who can guide us. So yes, I think it would be a great thing to have a coach.
And what about the other way around? So we talked about sort of the benefits to the mentee or the coachee, but what about the benefits in being the mentor or being the coach? How do you feel about that? Or did your research show anything when you were writing the chapter?
Again, there are numerous benefits to being a mentor. I think we often think of the benefits to the mentee, but I think being a mentor can provide a sense of duty, a sense of purpose. I think it gives you a bit of feedback, perhaps, on how you are functioning as a clinician, seeing someone from a different generation. Not always the case, though, as we've said, but that can be, and it can help mentors avoid burnout themselves by having a different string to their bow. So I think it is useful to have. To be a mentor.
Yeah. I mean, I do a lot of coaching, and I'm a coach as well, and absolutely feel, for myself, it gives me a huge immense of sort of personal growth, space for personal development, and really builds that relationship. And I think you touched on relationship right at the beginning, didn't you? So what do you think makes for that relationship between a mentor and a mentee? Have you got any kind of, what would you say makes a good mentor, makes a good mentee? What's that relationship need for it to be a successful and treasured one?
Sure. I mean, I think for me, the thing that I think would be the most helpful thing is the fact that you actually have to want to be part of that relationship. I think there's no point signing up to a mentor program as either a mentee or a mentor if you don't really want to be there. And personally, I remember actually being a first year medical student, waiting eagerly for one of the first things in my medical student diary, waiting for my structured mentor to show up, and to this day I still remember that they didn't, which is a real yeah, you can see I haven't forgotten. So it's a real shame. I think you've got to want to be there. You've got to, because that will affect the relationship significantly. I think there are certain attributes which really help personally to be a good mentor and mentee, and that's being positive, as a mentor, being non-judgmental, being constructive in your feedback. I think both parties have to have good time management. You've got to make this happen, and it's not easy. We've all got really full diaries. It's often hard to carve out that time to have something else to do, but I think having some kind of structure to the relationship, perhaps putting in the diary that you're going to meet, for example, once a month, having some plan in place can be really useful. I think it's all important to remember, again, mentors are often not remunerated for their time. So again, that goes with wanting to do it. You can't just necessarily expect that person just to give up their time as a mentee if you're not willing to do your part in that relationship as well.
No, I think that's valid, actually. The notion of accountability is really important, isn't it? And that's the two-way thing, is both mentor and mentee being accountable to each other. But that accountability is what pushes you forward and keeps you going in the right direction that you're aiming for as well, in your kind of professional growth or personal growth, or the challenges that you're facing. So I think that's a really important point that you raise, is that that accountability, and actually the fact that you remembered it for all these years that you're it really shows how important that really is, that degree of commitment to what you're about to embark on, for sure. But it's a bit of a sea, isn't it? So what would you say to me if I was looking for a mentor or a coach for myself? Where do you go and find one that is going to actually be that perfect match for you?
It is like any relationship, really. Again, you've got to, like we say, you've got to click with that person. There are different approaches to this. You might find that you have a network that you can approach. Perhaps someone's been a mentor previously, and they may be part of a formal mentoring program. I know that the university and local deanery have mentorship programs which have proved really successful, where there's a formalized process to matching up a mentor with a mentee. But again, you've got to have that initial connection with that person to be able to make it work. So yeah, I think exploring networks and that's often the best. Word of mouth is often a useful way, or perhaps just finding, like I've said, someone that you've worked with before and just approaching them and seeing if they would be willing to be a mentor.
That's so important. And also not being afraid to say, this isn't working for me. It's okay to move on and find your match. I think that's so important. It's like with any therapeutic relationship, whether you're talking to counsellors or therapists or having more specific therapy, that relationship is so important. Even with your doctor, I think it comes back to that connection, doesn't it? But being sort of bold enough to say, this isn't right for me, and moving on to find that person is important as well. So
I think that's a really key point. Actually, I think it's recognizing when something isn't working and not being afraid, because you've got to get something out of this. There's no point just showing up if it's not going to help you or develop you.
And now here is your lifestyle first prescription. Your 3 activating actions to take you from knowing to doing.
So have you got 3 takeaways for us today?
Of course. So, firstly, given this podcast, I would definitely say go and find yourself a mentor or coach. And that can be for work or even for something out of work. I think, that side of things is really important. We can all develop, we can all learn something, and having someone to guide us can be really useful. I think the second point is making sure that relationship, the mentor-mentee relationship, is compatible. And by that, I mean making sure perhaps that you encourage regular meeting, that you have a good personality click, that you want to be there. And I think the third thing is to establish ground rules, again, following on from my previous point, and just formalizing it, actually. And like you said, not being afraid to say, this isn't working. I need to rethink this strategy. But using all your networks to find somebody can be really useful.
Brilliant, thank you. I think those are 3 very key points that have come up in the conversation today. And I think, it feels as though commitment is a big word that goes along with mentoring as well, on both sides of the fence, really. So no, thank you for that, Nita. That was really, really useful. So I'm sure people will be interested in reading the chapter and perhaps finding out a bit more about you. So where's the best way to get in touch with you or find out what you're up to?
I'm on Instagram as Dr Nita M, and also with the Healthy Prescription book. I'm a GP in Bristol, as you said. So feel free to contact me if you wish to discuss this further.
Amazing, thank you so much. I've actually really learned a lot myself from that conversation. So
that's brilliant. Well, thank you very much for having me today.
Very welcome. And before I bring today's episode to a close, just a reminder that the doors to the Lifestyle First Academy are open with a course designed to help you to discover, notice and activate who you are, what you want and where you are going so that you can create a happy, healthy lifestyle. And I would, of course, love you to subscribe to this channel. The links are just below, so just subscribe and share so that you too can help spread messages of health that matter. Which leaves me simply to say, as always, I wish you a happy, healthy day.
Thanks for joining us on the Lifestyle First podcast, making self-care as easy as 1, 2, 3. Don't forget to subscribe and share, and we'd love it if you'd be kind enough to leave a review. To learn more or to arrange a consultation, please visit www.dralkapatel.com. See you next time.